This will go down as one of the simplest, most profound models of the lumbar spine ever done. The math on it was very robust and it was very sound. We modeled the lumbar curve with an ellipse. We then were able to take that and say, well, that's what a normal spine looks like. You have an elliptical curve, more curve down at the bottom. What does a back pain subject have? Does a back pain subject have normal alignment or do they have abnormal alignment? Well, let's find out. This is a milestone paper. It's the first paper ever to do what they did. It's not the first paper to look at normal and chronic pain, but it's the first paper to look at the segmental analysis of chronic back pain subjects' lumbar curves compared to the segmental analysis of normal subjects' lumbar curves. Here's what they found. Chronic back pain, statistically and clinically, has a reduction in their distal lumbar curvature. They have more proximal lumbar curvature, if you read the Jackson paper. So they lose their lower lumbar curve, and they increase their upper lumbar curve. Qualitatively, it will then change its shape towards a more circular geometry. Also, what can happen, depending on the measurement you use, if you only use the end of curvature, like T12 to S1, you might in fact find no differences between chronic pain and normal subjects. Because they're losing their lower and increasing the upper, the total curve may in fact stay the same, but the shape of the curve is what? Entirely different. The Jackson paper, 1994. We saw that and we said, that prompted us to do our study that said, I wonder if the model will change in chronic back pain versus normal subjects. So we did a study where we took our 50 normal subjects, compared them to 50 chronic back pain subjects that were matched for age, weight, height, and sex. Also looked at 50 acute low back pain subjects and 24 pathology subjects. Now the pathology group is the only population that had disc degeneration and retros and spondies. The other three groups had none of that. The other three groups were in fact very highly matched. No degeneration, no anomalies, no instability. And they were matched for age, weight, height, and sex. The only difference between them was one group was normal, one group had chronic pain, and another group had acute back pain. Guess what we found? Our elliptical model could strongly discriminate between the subjects. We could tell you what group you were in based on the shape of your lumbar curve in the sagittal plane. That was published in the Journal of Spinal Disorders in 1998. It was a groundbreaking study. We also looked at the measurements of segmental curvature. We showed they were different, but what we said was it's more sophisticated to actually model the spine, and that's where a lot of the differences show up. It's the shape and the rate of curvature change that's different in normal versus chronic back pain subjects.